by the end of the week. If you haven't already, please put your name and agency in the chat. And if there's more than one of you in the room, please include everyone that's in the room. And then feel free to put questions in the chat as we go. There'll be some opportunities to respond to questions in the chat. If you're having trouble with the chat, it's okay, unmute to ask your question if someone's not picking up on that. But Julie's in charge of the chat and she does a great job. So hopefully we'll get everyone's questions answered. So at this time, we can go ahead and start recording if we haven't. So today's agenda from 9 to 10, we're going to walk through kind of the components and the basic content of what logic models are, why we do them, why they're useful to you as a program. And then we're going to, from 10 to 11, or about 10 to 10:45, we're going to break out into 2 different breakout rooms. I believe we're planning on having like diversion and truancy groups programs together, and then the other programs that are on wheel group together in a room. And we're going to practice and walk through putting together a logic model for you. And it's also a time for you to ask questions, maybe about a logic model that you have or that you've tried, those kinds of things. So we hope that's really helpful to you. And then we know some of you might already have pretty extensive logic models, and maybe you're working on beefing up your logic model. Maybe you've been asked by a grant funder to do a much more extensive logic model. So from 11 to 12, the JGI team will stay on for a little bit. And if you would like information or would like to dive in and do a much more in-depth logic model, we're available to stay on and help do that work with you. If no one stays on, or if no one joins by about 11:15, 11:20, then the session will be over. And like I said, we'll send out the information by the end of this week. So, okay, so let's jump in. I wanted to just start us with a quick just reminder and overview of what we've talked about so far in this evaluation series. In October, we just did an overview, introducing you to some of the more in-depth concepts. We talked about why evaluation is important, because evaluation helps us measure our effectiveness. It helps us highlight our successes. It helps us find out where our gaps maybe are and where we might need additional or different resources. Evaluations help us measure it's really core to implementation science, right? It's in that wheel of, it's a continuous cycle. We can't be stagnant. I like to use the example of Blockbuster, right? They were the primary, like everybody went to Blockbuster, right? That's where you got your movies. I remember even having to check out like a VCR, those kinds of things. They were at the top of their game, but they failed to plan. They failed to really evaluate and see what's coming next, what's going on in the environment that might be a threat to their business model. And we all know what happened to Blockbuster, right? I think I just read an article the other day, there's one left, like in Idaho or something somewhere. But that's what can happen to us as programs if we're not doing evaluation, we're not really looking at that implementation cycle of doing and acting, studying, and then revamping, right? So that's that implementation science piece. And then we talked about the elements of good program design. So things like risk, need, responsivity, and dosage. What does it mean to use a model program versus a homegrown program? We use the example of a cake, right? And baking a cake. And what are the primary components of good program design, and what's a good fit for you based on your community planning and data and all those different kinds of things. So when we talked about common elements of program design, we talked about leadership and your workforce, your target population, your goals, objectives, screening instruments, evaluation, and your program promotion. And all those things are really important because they are going to feed into what we're talking about today in terms of logic models. So today, our objectives are to understand the purpose of a logic model, to identify the core components of this logic model, to identify data point opportunities within your program logic model, and to review or develop a logic model for a specific program. All right, so who remembers using some of these tools, right? I have a 17-year-old daughter who's driving, and I said, you don't know how lucky you are to have Google Maps and to have it just tell you where to go all the time. I remember using maps and atlases on family vacations and thought it was the coolest thing when, MapQuest came out, until you had a detour. And of course, it didn't tell you about the detour. The main thing about maps is no matter how they evolve, they always serve a core function, right? They are a roadmap. They are the guide that tells us how to get from point A to point B. And that's exactly what our logic model is for your program, okay? It tells us how we get from where we start to the outcome of where we want to finish. How many of you have just put in the chat, how many of you have done logic models or have a logic model for your program? This kind of a roadmap. And Julie, maybe you can kind of share, because I can't see the chat. So maybe you can kind of
Yeah,
share.
I'm looking at it right now. So far, a couple of people are responding that they have one. Got 2 right now.
And for those people who have their logic model, I'd be curious, how often do you look at your logic model? Or did you do it because you wanted to, or because a grant funder or something else required you to do
I think that's a great question, right? Because even if I'm being super transparent, most of the logic models I've done are associated with a grant. And so once that grant is out of date, then my logic model is out of date, unless I'm doing an evaluation, right? So I think that's important to think about the timeliness of it, or how current it is. Monica, I was having flashbacks when you were talking about maps, because I distinctly recall driving and looking at a paper map. I was like, oh my God, I remember those days. So let's not do that.
Looks like we've got 3 or 4 folks that have logic models. Looks like mainly probably created for grants. So purpose, having a purpose in mind there. Some people are saying that there's probably a little bit out of date. Again, it sounds like a lot of it was tied to having to have it for a grant.
Right. Yeah. Which is pretty common. And there's definitely nothing wrong with that. I think the main thing is we want you to use a logic model so you feel that it's useful to you and your program on a regular basis, right? Just like we don't always look at a map unless maybe we're going on a trip, right? But once we're on that trip, we have that map all the time. So your logic model, when you're implementing and working your program, should really be that map that you're taking out at least once a year and looking at and saying, how have things changed? Have we taken any detours, right? Have the roads changed? Has the course changed? And then you can update your logic model, not only to help you with your program, but then it's ready for the next grant opportunity. And you won't be scrambling at the last minute. So in my experience, and I'm sure you too, Anne and Julie and Amy, different grant funders often have used different logic model formats. There's lots of different kinds of formats out there. And so today we're going to focus on just a kind of a basic logic model for you. And so that we can practice, you can kind of brush up on your logic model skills. And then you can go more in depth with it. And if you don't have time to stay on today, but would like to set up a time with JJI, we're happy to always work with you, answer questions, just brainstorm with you. So feel free to reach out to us anytime for that kind of support if you want to after today.
And real quick, I'll throw in, Monica, like when we're thinking about logic models as a map, one thing I've noticed that programs do is, you're thinking about your process, what you do, what you're doing in your car. And we really need to be mindful of external factors, which we'll get to, but all of you can think of, right? COVID was a huge detour in all of our logic models and all of our programs, whether we thought about that or not. It was a massive detour and caused all of us to change the interventions and the activities. And so I encourage you to think about like what you're doing as we go through this, but also those external factors definitely influence us. So, yeah,
exactly. Okay, so we've kind of started touching on this, but what do logic models do? So these maps, these logic models help us navigate evaluation readiness. They really set up the foundation for a researcher to be able to evaluate your program. Because we'll be talking about what are the things that go into your program, what is your, based on your goal, and what are your hopes and outcomes for this program. And so that really helps set up the vision and the basis for an evaluation. And Anne's going to talk about a little bit more about evaluation in a little bit. It defines the flow of your program, right? So it really is kind of, in some ways, a process exercise too, right? Seeing how kids come into your program and how you hope them to be successful. And do you have all the right components in order for that to happen? It identifies opportunities for data collection. At what points can you get feedback from youth and families in your program? At what points are you collecting information about them and from them? Again, this all sets you up for being able to do reports, being able to tell the story about your program and evaluate it. It helps you really think through defining success and clear outcomes for your program. So if your outcome is to have people successfully complete your program, what does successfully complete mean? And so that you make sure that your program is all on the same page with that outcome, as well as your stakeholders that are involved in your program. And it helps you identify where resources are needed. So if you have gaps in resources or you're doing budgeting for your program, for your county board to present, all those different kinds of things, it really just lays out that visual picture. I'm a visual person, so I like these logic models because it helps me see where can I attach, budget items to the things that, and other types of resources. And this is a great way to be able to go to other people in your community. Maybe you don't need monetary resources, but you need volunteers or you need donations for things. This helps you kind of pinpoint where those are. So, Anne or Julie or Amy, anything else you would add to that? Okay, any questions about what they do? Feel free to drop in the chat. Okay, so what do we need to do or have before we kind of get on the road, right, with our logic model, before we go on our trip? You think about the things that you do to prepare to go on a trip. I'm leaving to go out of town tomorrow, right? So I've got what's my goal? Why am I going on this trip? What do I need to pack? What's the weather going to be like? All those different kinds of things. So it's the same thing for your logic model. And this is why we talked about these program elements in our last training, because it's really important before you do your logic model, it's really important that you know your why. Why are you doing your program, and what is the goal for this particular program or situation that you're doing this logic model for? Also knowing the vision and mission of your program is important if you have that. And then some of these other things help you kind of go more in depth that might guide more in-depth logic models. But does your program have any guiding values? Maybe that's applicable or maybe not. Do you have any specific program priorities? These might be potentially guided by the funding source, or maybe it's a particular outcome that you want to have. Maybe it's that your program is educational or professional development, those kinds of things for your program. Knowing your priorities are really important. Are there others? Oh, go ahead, jump in.
I was just going to say, I'll just jump in. If anybody is feeling like, oh my gosh, we're undergoing a big change, or I am a newer program, there are evaluations, and a great place to start with anything new or a big change is the logic model, because it forces you to think through each of these specific questions. So, yeah.
Right, perfect. Okay. So let's dive into what are some of the core components of any type of logic model that you'll probably run into, right? And the first one is that program goal. So as we get into doing these and practicing these, know that you're going to have like your agency goal, vision and mission and goals. And then many of your agencies run different types of programs, right? So today, what we're talking about is those actual programs, those youth serving programs that you're doing. So what's the goal of that program, right? If you're a diversion program, what is your goal? Is it to ensure that kids have no further system involvement, right? That you're serving that population. So being really clear on that program goal is important. Then we have inputs. And we'll get into in depth in each of these. But inputs are those things, those resources that go into your program. And then outputs, those things that are produced within your program, right? Activities that you do, the people involved in implementing those things, both as staff or volunteers, but also the participants of the program, who engages in this program. And then we look at outcomes. A lot of project models or logic models have you look at short, intermediate, and long-term outcomes. Depending on what you need and the scope of your program or activity, you may only just look at short-term outcomes. You may not get really in-depth with long-term outcomes. It just kind of depends on what you're doing. So you need to kind of gauge that because you can use this logic model format to break down, maybe it's like Ann said, maybe it's not changing your whole program, but you want to explore changing a specific part of your program. And you can use this almost as kind of some strategic planning processing as well. Okay, so here's just a visual example, and this is kind of the example that we will use as we work through logic models today. But you can kind of see, like I said, a visual person always helps me to see the layout of what we're looking at. All right. So let's go a little bit more in depth. Let's talk about what are inputs. Inputs are the resources that are invested or available to deliver the program. So these resources could be people resources, right? Like your staff, volunteers, sometimes the administrative staff in your organization. Who are the people in that? Your resources could be money, right? It could be grant money. It could be all kinds of different money resources. Your infrastructure, right? So this maybe the system pieces that you're involved in. It could be your organizational capacity. So what kinds of things in your organization do you have that contribute to this? Maybe you have a foundation associated with your organization or a volunteer organization that helps support. And what's the community capacity? What are the community inputs into your program? Maybe it's the Y gives free passes, or they offer their space for your participants to go there for part of their programming. Those are all just some examples of what resources could be. So other thoughts about what you see resources could be that would input into your program? Or Ann, jump in if you have things that we missed.
I don't know if you can see my unmute. I'm trying to figure out that. So I just want to say, like, one of the primary things I see when programs want to implement an evidence-based approach is they sometimes will grab like the resource they'll find is something online or a new program model, and they'll find this great idea like at a conference. And where I find that we don't think all the way through it is really that infrastructure or people resource. So you'll find this great model at a conference, you'll come back and you'll be like, great, come on, diversion staff, we're going to run this model. And inevitably what happens is if you don't have the capacity, then you alter that evidence-based approach and it's no longer evidence-based. So you start saying, well, you know, I can't do 10 sessions of this, so I'm going to do 5. Or I can't do the specific 2-hour groups, it's too long for my population, so I'm going to alter that. And that's really, I think we really have to be mindful of every single one of these resources, like almost like a recipe, like we've used that analogy before. If you leave something out, it really does alter it. So when you're thinking about these inputs, especially if you're using something like an evidence-based model, you have to consider all of the different resources, people, infrastructure, even in some programs, there's mindfulness given to the space that you hold a group in. So really think about that, because I think that's a place where we in the state and probably everywhere, right, that we like find a great model and then don't really have the resources to run it. So
Other
In the
questions?
chat, Connie also offered school and community/county partnerships, which I think is an important piece as well in there, especially for a lot of these school-based programs. Having that relationship with your local schools, certainly an important part to consider as you're designing your programming or thinking about what sorts of resources you possibly have.
Right, great, good point. Okay. So let's talk about outputs. Outputs are the products and services that are delivered as a result of the program activities. So these activities we can break these down into the activities. So the key activities are actions that are carried out using the inputs. These are things that you often list, right, in your activities timeline or whatever in your grant application. So they are, doing screening and assessments. They're doing intake meetings. They're running groups. They're those kinds of activities that our actually youth are participating in. And then you also, I think it's important to identify who are the participants, right? The individuals or groups benefiting from and or participating in the activities. So once you identify, okay, we are maybe one of the outputs is running a cognitive group. Well, who are the participants in that? Who are the youth that are participating and how do they get there? And who are the individuals running that group, right? Maybe they're staff, maybe they're volunteers from the community, maybe it's both. So it's really important to keep that in mind, identifying both the people who are doing the activity as well as benefiting from that activity. Okay. Questions? Okay. And then we get into outcomes, right? Outcomes are the change that you expect to occur over time in the short, medium, and long term as a consequence of the program's activities and outputs. So like we said, these time frames should be defined by the type of program you have, right? So if this is maybe a prevention program and it's a short-term type program, your outputs may look different. You might only have a short-term and a long-term goal, or you might not have that intermediate, or you may only have a short-term outcome because it's not a really in-depth kind of program. Whereas if you have a diversion program, you might be having kids in your program for 6 to 9 months, right? And then you might be tracking them for up to a year for those long-term outcomes for recidivism. So be sure that you kind of know and are realistic about the time frame that you set for identifying those outcomes and that you're actually able to measure those outcomes. Like we said, they have to be in kind of measurable increments. And so Dr. Hobbs will talk about this in just a little bit in terms of evaluation, right? But can you actually get the data that you need to measure those outcomes? Is it based on time? Is it based on actual product? Is it something that people are producing? So knowing those measurable increments is important. And that you can get the information and know that this can evolve as your program evolves. And that's why we said earlier, it's so important to not just put your logic model on the shelf, right? As you put this logic model together and you start working your program and you think you know the outcomes that you want, you might find that either you can't collect the data or maybe your goal changes a little bit, right? As things evolve, you need to change those outcomes that you're measuring so that you are accurately reflecting what's happening with your program. Anything, Anne or Julie or Amy, you would add to that? For questions? Okay. We are going to try one of these together and we're going to keep it really simple. So in my house, we've been dabbling in a little bit of gardening. And so we're gonna plant, our program is going to be planting a vegetable garden. Okay, we'll keep it something tangible and easy that we can all hopefully relate to. So our vision is to grow a garden full of healthy food for my family. And the goal is by the end of summer, the family will have enjoyed fresh produce and preserved food for the winter. So our priorities are vegetables my family will eat, because there are definitely some they will and some they won't, right? And a space that's conducive to a healthy garden. So making sure that, right, that we have the right space and that we have vegetables that can be frozen or canned. Okay. So I'm going to, I'm all of a sudden not seeing my whiteboard. Amy, can you pull up the whiteboard? Or do I stop sharing to do that maybe?
I'll see if it will let me. Yeah, you have to stop sharing to do it.
Okay. Oh, there it is. Okay, perfect. Perfect, Amy. All right. So as a group, and feel free to either unmute or drop in the chat. Amy's going to type for us, I think.
We might be able to type our own too.
Oh,
you know?
Yeah, I think so. Yeah, I see people floating around. Perfect. So let's put a title up here at the top, maybe, Amy, and let's put inputs. So let's think about, if we're growing a vegetable garden, what inputs would we have? Seeds, yeah.
I think if you click on the little T in the line below, it'll give you a text box. Sorry, I've not used this before, but
There you go.
it's
Good.
really hard to write with your cursor. Let me see if this helps. There we go.
Great. Seeds, yes. What else? An area to grow. Fertilizer.
It is harder to type in this. I don't know what's going on. I deleted.
Yes, that's your freezer space, right? That's exactly right. We need access to water. Absolutely, a water source. Tools, yep.
Is anyone having an issue seeing the whiteboard on their screen?
No.
No.
If you have multiple screens, I find that I sometimes lose one of mine, so I would minimize.
Jill said she can't see. Yeah, that happens too if you have multiple screens. That's weird. Plants, right? So sometimes we plant from seeds and sometimes we buy plants that are already started, right? Compost, fencing. Yes, we had to put a fence up. I have rabbits everywhere. Perfect. Okay. So awesome. You guys you're getting really good. You've got the gist of it. So what would our outputs be? Let's start with activities. Oh, thanks, Erin. You may have to hide your video panel, all the faces to see the whiteboard. All right, so let's move on to outputs and let's start with activities. So what are some of the activities that you do in planting a garden? Right,
Sorry, I'm trying.
Oh, go ahead.
I was going to say, I don't know. I tried to move the screen over to start us in kind of a new column, but we don't necessarily need to. I don't know if you can see that or not.
I cannot see the new. Oh, I see an output column. All right.
Okay.
Right. So I'm starting to see things like activities are like tilling the ground, right? So preparing the ground. Monitoring growth. What else? Prepare the soil. Yep.
See, people are running around.
I know.
This morning.
Weeding. Yes. That's my kid's chore over the summer. It drives me crazy. Weeding is a non-summer thing. Watering.
So I'll just give a hint to like our more in depth at 11 is when we start thinking about this more in depth, you need to start thinking about assumptions. So we're making an assumption that the soil is workable. I live out on an acreage and I swear it's the soil, it's not me. So you can do tests, right? So we make assumptions sometimes about how a program's going to work, or why it's going to work, or why our plants are going to grow. And then when we don't see the outcome that we want, sometimes we have to go back and think about what is it, what happened there. So
Georgia added unaliving bunnies in the chat. And I know I can certainly relate to that with my garden. Maybe check all.
Yeah. Taking care of bugs, right? And the living bugs. Okay, good. So those are some of our activities, right? Those are a lot of the beginning activities. What are some of the ending activities as your garden continues to grow throughout the summer?
Well, if you don't pick things, I recently figured out if you don't pick things, they don't continue to produce, which is amazing. I think that's really kind of awesome. But yeah, you have to go out and actually harvest from your garden or it stops.
Right. And our goal was to have things to can or freeze. So eventually you're going to be doing canning and freezing, things like that. So good. I think we're getting the gist. And so then who are the participants in these activities? In my house, it's me and my kids, possibly my husband if I promise to go buy a Dairy Queen or something afterwards. Like, he's not in the gardening space, but if he has to, I can bribe him.
I was gonna say, doesn't that interfere with your goal of healthy vegetables? I guess it doesn't. You still can eat your healthy vegetables and have Dairy Queen.
Right.
So
Neighbors are some of the participants. Last year, my mom liked okra and we planted 3 rows of okra and it went crazy, right? And nobody in my family ate it except her. So we were giving lots away to neighbors, co-workers, right?
yeah, Monica's the one who gives her friends okra.
Right. I would ask everybody, do you like it? All right. Okay, and then short-term outcomes. What would be the short-term some short-term outcomes?
Harvest. Something comes out of it.
Right? And different plants produce at different times, right? So lettuce is kind of burned out by July, and then so you're harvesting at different times. So harvest times for each of your, if you got kind of really in depth with your logic model, you might have listed all the different kinds of plants that you want, right? So then you could have your outcomes align with what time of year what time of the summer you would be harvesting those different ones.
Mm-hmm.
Yeah, fresh produce, evening dinner. Exactly. So there's things that are more immediate, right? That you can see that happen right away. Would we have any intermediate outcomes, do you think, in planting a garden? Oh, I like bonding with family. That's a good one. Healthy snacks. Yeah.
It depends on, I think, how you're looking at long-term. Like how you look at long-term will shape how your intermediate what your intermediate is. So I'll wait and see if we get to long-term and then I'll throw out my intermediate.
Yeah, and that's okay to do it that way, right? Sometimes you have to see what's the long-term. Gathering seeds for next year. That's a good one. That might be more of an intermediate, I think.
Yeah.
Yeah, that's a good one.
Yeah, that's where it was intended to go. Sorry.
No, good
I'm dragging this around.
Yeah. Food for the winter. So maybe your intermediate is canning and freezing, and then your long-term outcome is that food for the winter for the next year.
Or long-term might be better health for your family, right? Like non food that doesn't have preservatives for your family, so long-term health.
Great job, everybody. So I think we kind of get the idea, right? Hopefully that just was a good non-work related example. So we can end the whiteboard, Amy. And we'll go back to our
So I think the next section is where I come in, and we start talking about evaluations, right, Monica?
Yes.
So I'll go ahead and start talking as we get to that screen, but you can see even as we were doing the whiteboard, like your brain starts working on, okay, what is my outcome? How do I get there? So in some ways, you're all thinking evaluation, even as you're putting these together, right? But for different systems, different programs, different points of that program, when you have a brand new program, you need a totally different map. So it helps to think about these things at the most minute level, right? Like if we just use the example of a garden, right? You wouldn't use like, I guess you want to think about your programs as individual programs, not at the agency level. So we can go on to the next screen. I'm going to talk predominantly about 3 different evaluations, but there are definitely more different, there are more evaluations than the 3 I'm going to highlight. So when you think about evaluations, a formative evaluation, sometimes these are called feasibility even. You're really looking at, am I ready for an evaluation? And I'm going to go more in depth in these. A process evaluation is probably where most of our programs in Nebraska are at, unless you're brand new, starting a program. You're looking at what do I do, and does that map to my outcomes? And is it logically related to those outcomes? How can I expect an outcome from this intervention that I'm using? And then outcome evaluation is looking really towards effectiveness and those longer term goals. Are we keeping kids out of the system, right? When they do this particular type of intervention and the dosage is right, what does that look like long term after they complete your program? Maybe through their teen years. There is a logical point where we can't expect every program to last, right, 10 years. So there's an effect that it's not reasonable that your programs are really going to last into adulthood for most adolescents. Now, there can be meaningful singular events, and I was talking to somebody about this yesterday. Sometimes something is such a huge impact, but those are usually individual circumstances and not so much a program intervention. So you can think of like, I've worked with youth who've had been in an accident with their friends, like a car accident, and that is definitely life-changing and changes long-term outcomes. But we don't usually think about those things when we're thinking about our interventions in our programs. I say usually, and Monica, you can move to the next one. I'll just make one quick point. Some of you will remember the vehicle when they used to bring in, maybe they still do it for like Mothers Against Drunk Driving, they'll bring in the crushed car. That's an intervention that's really designed to tap into and kind of stories around car accidents are designed to get at those long-term goals. But back to types of evaluation, you can find even large agencies like the CDC, the Center for Disease Control, they do a lot of work around formative evaluation. And the reason is sometimes we jump in and we're going for it and we're running programs and groups and we think we know what our vision is, but sometimes we haven't slowed down long enough to really think through it logically. So the CDC does a lot of work on whether or not programs are able and ready to be evaluated. Like, have they given the thought to this? In Nebraska, really, the Crime Commission and the work JGI has done, most of us are in a position already to be evaluated or coming up on that cusp. And the reason is when your agencies call and we say, what program type are you? That is, we are starting with your program goal, right? So sometimes I'll talk to a program and they'll say, well, I work with families and then I help the youth get to school, and then we'll do a mental health intervention. And what I'm hearing in my brain is 3 different program types, right? Because we're blending things together. So the best thing you can do is have a very clear program goal. Clearly, you can have sub-programs within your program, but you have to have a very clear program goal to get there. Imagine again the map. If you're like, I'm going somewhere in the United States, you won't even know what direction to go, right? You won't know whether to go northwest, south, or east. So that gets to the measurable outcomes. Like once you know a clear goal, you can say, I'm going to go 5 miles a day until I reach San Francisco. But you need a speedometer or something to help you collect that data and to know, are you making those incremental steps in that direction? With most of the kids that we work with, they will be incremental steps. And in order to know whether or not we're making progress, it's really helpful to use uniform definitions. So as I mentioned, in the state of Nebraska, because we already have some of these uniform definitions, We all know, and going back to my analogy of, 5 miles a day towards San Francisco, we all know what a mile means. So if you haven't reviewed those definitions, I'd encourage you to go back and do that. A couple of years ago, maybe 3 years ago, Amy Getchy and another student actually went on site and worked with programs and measured how well the programs know their definitions. And that's why, right? Like it's really important if we're going to measure things to have this. So these are all part of that formative evaluation, getting ready to evaluate. The last pieces of this are if you have a communication plan or viewing or thinking ahead to continuous improvement, like how are you going to use this data once you have it? So for example, if I know I'm supposed to go west 5 miles a day, that's my intervention to get to San Francisco, I should have some kind of gauge that tells me if I'm off track. I need some kind of process that'll tell me if I'm off track. So this is really where I want to spend a little bit more time, because most of our programs in the state of Nebraska are at this next phase. If you're a brand new program and you want to talk through that formative evaluation, I'm happy to do so. Just put your name in the chat and we're kind of keeping a list of who would like some follow-up. But most of our programs already have that groundwork laid through Evidence-Based Nebraska. You have your definitions, you have your program type, and those all point toward the goal. So the next step is really this step, and it's a process evaluation. And this tells you, are the activities that you're doing in your program, are they being implemented, and are they the right type of intervention to get you to that output, that what you desire to happen next in your program? These should really, I'd encourage programs annually to look at this process, because, or to do a process evaluation, pull out your logic model and say, okay, I'm running a drug and alcohol group and I'm working with a lot of kids that have shoplifting offenses. We all can see the disconnect there, right? So sometimes your population changes. Sometimes who the county attorney is referring or the school is referring to you changes. And that's an external factor that should shift your interventions. I don't think it needs to be done more than annually, but you can see there'll be times where there's a miss unless you're running every type of group and program available, which we can't, right? We can't do that, especially in our smaller areas. So this process, doing a process evaluation, always starts by going back to a logic model and looking at the activities and the output components of that logic model. You'll find that if JGI is doing an evaluation with you, one of the first questions we'll ask is, do you have a logic model? And if not, we'll encourage you to develop one, because it forces your brain to think about the logic of your program. So you can go to the next one, Monica, please. So the kind of things you can expect when you've done a process outcome, you get results from this. So the kind of things that you see and what it's designed to do is to help you improve your program and change it. So I used a very simple example of if you're running a substance abuse program and you're serving a lot of youth, you're seeing people come in your program or youth coming into your program that are shoplifting, there's a disconnect. So you're probably not referring them to the substance abuse class unless they have some kind of assessment that shows they need that. So that disconnect, you're already like in your program internally, many of you are running a logic model in your head, right? You're not referring youth to the service that doesn't match their need. And that's awesome. The problem comes in when, if you have a large, like if the majority of your population you're serving is shoplifting, then you need a different type of group. Or if you have, 50% of your kids are shoplifting and 50% are substance abuse, then you need multiple groups. So really the process outcome helps you think through this, think about the different types of interventions you need, and forces you to look at your resources and whether or not you have the ability to meet all of those needs, because that's usually the obstacle. I talked about this a little bit earlier, but what I found is when our programs are like, oh my gosh, I need to serve these two different populations, what we do, and that can be like the type of offense, it could be the type of risk we see, it could be age. When I ran a diversion program, what we were finding is we had, kids that were 17, 18, and then we had 11, 12-year-olds. So this was before, I think 12 was the minimum age, back a long time ago. But we had some really young kids and we didn't want to blend those populations. So looking at who's coming in or doing a process evaluation really forces you to look at who's getting services, who's being referred, What are you providing? How much of a dose? Like how big are your groups? And then where do those program activities take place? Sorry, my Alexa wants to warn me of something. And what the barriers are. So you can see sometimes like the time of day of a group isn't working because you have 0 attendees, or you have no parents that show up for something. You can see there's a miss, right? So that's the goal of a process outcome, is to really tell you the interventions that your program is running, are they effective? And again, that should be done at the very program level. So if you don't mind, you can go on to the next one. So most of you have heard us talk about outcome evaluations, and some of this is driven kind of by the language in statute. Is outcome evaluations are really designed to look at measuring the program's effect on the target population. And because our statute is written that way, it kind of fast forwarded us all, and we're all like, okay, we need to prevent kids from entering the system, right? Or re-entering the system if they've already had a touch with the law or brush with the law. So although we focus on that a lot, I can't stress enough, the importance really is what are you doing in between to get to that outcome? We talk a lot about this because, like I said, it's in statute, so you see a lot of our reports mapped to the effects or the outcome of your program, and these are really short-term outcomes, right? So in diversion, an intermediate goal is really, did you keep the youth out of court, and did they succeed in your program? But the long-term outcome that we're really hoping, and this should say refrain, I'm so sorry, I have a typo. We want them to refrain from subsequent law violations. So I hope you can see how this links back to your interventions, because if I require a youth to come in who has a substance abuse concern, and I require them to do a shoplifting class, first of all, it's going to frustrate and anger the youth and the family, and it'll probably make things worse. So lining our inputs and our activities that we do up with our long-term goals is super important if we want our programs to evaluate out well. So some examples, I mean, for diversion, it's really preventing these long-term law violations, but really when you're thinking long-term, we want to know how long does that last? How long is this effect? Same thing for attendance. I've evaluated some attendance or truancy programs where we can see the youth's attendance improves while they're in the program, but the minute they exit the program and they've successfully completed, their attendance problems kick right back up. So really, ideally, our interventions are going to have a lingering or a lasting impact beyond that one measurable outcome that's in our logic model. And then for mental health programs, same thing. Like really, anybody who's currently working with a youth or a family, we want to improve their immediate mental health, right? We want our groups or individual sessions to bring peace to that individual right now as they walk out of our office. But then really long-term, we want them to have lead healthy, productive lives, right? And to successfully work in our communities. And so really it's that long-term goal that most of us will be looking towards, even when we don't write it on our program. So back to Monica's example, she really wants her family's health to be better, and doing that through a garden, that's the means. So hopefully you see, like, evaluation is absolutely tied to logic models. They can't be extricated. They should be done together. And if you don't have one or don't have a current one, I really encourage you today to work on one, even if it's just a copy on your desk, and then we can follow up and help you look through it. So I think, I don't remember what screen I'm on. Oh, we're at break time. Went very fast.
All right. Before we do breakout groups, does anybody have questions about what Dr. Hobbs just talked about in terms of those different types of evaluation pieces and how logic models line up, or anything that we've talked about so far? And feel free, you can unmute as well. Okay. So, and correct me if I'm wrong, but at this point in time, we are going to go into breakout rooms. And we have 2 breakout rooms set up. One breakout room will be for folks who are diversion and truancy programs. And the other breakout room will be for all the rest of us. And our goal is we will dive into putting together a logic model for your program type. So hopefully that will help and have an opportunity to just work together kind of in a community of practice. And then we will be back at, let's send everybody back at like 10:40 to debrief. Does that work?
So I have a question. I would like some people to try to jump into a room. You should see 2 rooms set up. I can't. And so are you able to select your own room? If not, I'll have to go through one by one and assign you.
I can always do 2 where you select your own, which one you want to go to. So just
Sorry, Amy, can you say that again?
I can make it so they can select which one. So like room 1 would be oh, I think people already left, so never mind.
So how do we get into the rooms, Anne?
You should be able to select which room you want to be in.
Oh, this one. So how do I'm not being able to do that.
I don't see the options either.
Okay, let me. Is that Michelle Butler?
Yes, I don't see the options to where to go.
What room would you like to be in, Michelle?
What were the options? Juvenile programs? I don't know what the options again.
Diversion or truancy?
Diversion then. Okay.
Let me see. It's telling me it's doing something goofy. So you just give me a minute. It's telling me all breakout rooms will close in 1 second. Like, don't close the rooms. Okay, Michelle.
I see 2 rooms up at 2 rooms at the top, but I see a whole list of unassigned people. I see diversion and then other programs, but I don't.
Mine just gives me an option to join one. Like with mine, I haven't yet. Vanessa said that she doesn't see rooms either. She would like to be in diversion and truancy.
I went to one, and you sent me one that said join, and I joined, but then when I got there, it gave me 60 seconds and now it shut me out again.
Worst case scenario, we'll stay in the same room and go through an in-depth one, but I'm trying to assign you rooms. I don't know why it keeps limiting the time. It shouldn't do that. I should be able to close them. At least when I practice it, let me close them on my own accord. So
that's what it just did to me too. It just closed me out when I went into the truancy room that you invited me to, that gave me like so many seconds and then closed me out and put me back into the main meeting.
Yep, that's what it does.
That's what it does. I'm so sorry. Amy, in my staff, Amy is telling me she's stuck in a room. Okay, this virtual world, so odd. Why don't I close the rooms and we just go ahead in the interest of time. We can go ahead and use either a diversion or truancy example. We'll just have people vote using the chat box or any other program type. Does that sound okay? Since it keeps bumping people out of the rooms. And I think we can work on them and take about 10 to 15 minutes per program type. So whatever the most common program type is that you'd like to look at. Monica is telling me you're the host now.
Okay, it booted us out of the other one again after like a couple of seconds.
Yeah, so because it's doing that, I don't know why. When I use it for class, students stay in it for hours. So I don't know why it's not participating today. Probably because, we have a training and we wanted to do it well. That's why the system said, no, not today. So let's go ahead and do. Yeah.
Oh, I don't know if I jumped into ours was closing.
Yeah, I'm bringing it back into one room.
Oh, I got you. I'll mute then.
I'm going to go ahead and drop the Google Drive link or the Google Sheet link into the chat.
Perfect.
That's helpful if one of you wants to share that screen then.
I think Amy's on deck to share. She's the good typer.
So in the chat box, maybe we can determine if everybody's back in the main room. You should be. And what is a program type you'd like to go through in more depth? And I encourage you, like, use this, click on the Zoom on the Google Shared Drive and use it for your own programs. But it's helpful, I think, to go through one program type together. Like we did the garden, but let's do a real program type now. So do you want to raise hands? Like, do you want to do diversion? Do you want to do truancy? You think we'll be able to count them if we raise hands, or is chat box better?
I think hand raising is probably okay. We only have 2 screens to scroll through.
Okay, so I'm going to start with a attendance program. How many people, and do you all know how to use, you go to reactions and you can select a hand raised or a thumbs up. So please give me a thumbs up if you would like to do have us go through an example of an attendance or truancy program.
Amy, do you
looks
want
like
to unshare for a moment so it's easier for us to see the screen? Thank you.
1, 2, 3.
Looks like about 5.
We've got a hand raise in the chat too.
Okay, so we'll give them 6. Okay, put your hands down. Put your hands down. Now, if you would raise your hand if you would like to do a diversion program model. Claps. 1, 2, 3, 4, 5.
I think I counted 8 at one point in time.
Okay, and now for the chat box, if you could, if there's another program model that you would really like to look at, if you could put that in the chat box, that would be terrific. So thinking about mental health, mentoring, prevention promotion programs.
We've got prevention, promotion, and mentoring in here right now.
Okay, so in the interest of time, we'll go ahead and we will start. Because diversion popped with the most, we'll start with diversion. And Julie or Amy, one of you, if you want to take notes. Actually, maybe Amy, if you can take notes since Julie is watching the chat box. And if more come up, I think we just do it in the order of, we'll do diversion for about 10-15 minutes, then we'll do truancy. So starting roughly 10-15, 10-17, then we'll go on to prevention, promotion, and then mentoring. And that'll take up most of our time. And then we'll need to take a break. So, but according to our agenda, we won't need to debrief since you'll all be present. If it's not your program type, and you're like, I need to just step away for a minute and grab some coffee, it's totally fine. This is really for your benefit. So if it's not something you think is pertinent to you right now, I just encourage you come back about that time frame. Like if you really want to hear about truancy, don't be back later than about 10-17. That's when we will write myself a note. Okay, I think we can
Sarah or
share.
Amber, do you guys still have questions, or were you raising hands still just to vote? Okay, perfect. Just checking.
I have a
So
question. What is the Google? What is the link in the docs? I mean, in the chat, do we pull that up?
You can, Michelle, but it's what Amy just pulled up on the screen, if you can see it. So we just gave you the.
Oh, we don't need it right now.
You don't need it right now. You can save it and you can use it on your own as well. It's just a resource for you. And we'll send it out afterwards as well.
Okay, thanks.
You know what I realized, guys? I think the breakout rooms is giving us a headache because of the recording. Because the recording probably doesn't know which direction to go. I was like, why is this different? It's because I don't usually use breakout rooms and recording, but okay. So thinking about diversion programs, can somebody tell me what's your program goal? Or if you have a subtype of diversion, we can go more specific, but just broadly thinking, what's the goal of your diversion program?
Feel free to unmute too. That's fine.
Yeah.
Don't be shy. We know you all have some good program goals. What's your
Are there
goal
any
for your diversion program?
Are there any county attorneys on? Because I know some county attorneys have goals on these.
I would say one goal would be to keep kids, to reduce recidivism. Or keep them from entering the system further.
Yes, I like how you reframe that, because technically recidivism would be a new law violation, and some of our diversion
Right.
programs
Right.
really, yeah, so.
We want to keep them from entering deeper into the system.
Mhm.
We have to hold the kids accountable for their actions.
Mhm.
Is
So-
prevent recidivism different?
I think that's the same as
Uh,
one.
Okay,
Now, if you're a prevention program, we'll talk about that we think about that a little bit different, because that's pure prevention, right? But sometimes people refer to diversion as a secondary prevention. So that's really that first thing that we've itemized. Another thing we could list is, I know many county attorneys, like a goal is kind of a process goal, is to keep cases out of court that don't need to clog our court system, right? Cases where a kid could be held accountable outside of our traditional system. I would say out of court or out of the official, maybe out of our juvenile system.
I think
Do we-
somewhere on my thing, it says reduce crime.
So that's a pretty big goal, kind of not totally related to diverting some youth out of the system, right? So can you see like why? Woo.
Yeah, no
that's a-
pressure, Georgia, no pressure.
So I'd encourage you to sit down with whoever drafted that one and maybe just have a discussion about it. Because if your goal, what's your community, Georgia?
Cheyenne County.
Yeah, you got a big job then. You
Like
better
I
be
said,
running
No
programs.
pressure, no pressure.
Do any of you have, as part of your program goal, to impact behavior change for the youth that are in your program?
I was going to add something kind of along those lines, Monica, in terms of identifying what needs youth have and addressing those needs with programming.
Monica, would you repeat that question that you just asked that Anne responded to?
Yeah, I just wondered if anybody in their program goal for diversion has something related to like impacting behavior change for the youth that go through the program. I think we know from an evidence-based perspective, that's how one of the outcomes, right? That we know that kids will reduce their criminal behavior if they change their, yeah. Michelle has reducing negative behaviors and improve positive mindset.
We have teaching the decision-making skills to produce more mind or thinking outcomes.
So we're getting to that. In the interest of time, I think we'll stop with these goals, and now let's move to inputs and activities, because Terry, you're talking about something that belongs on this chart, but it's a little further down.
Right.
So, sorry, go ahead, Monica.
Nope, I was going to say the exact same thing.
So what are some of the inputs that we need to achieve? And it helps in logic models. Frequently you work across. And so in the interest of time, I don't think we'll do this, but you usually put them in kind of a logical order, even in program goal. So program goal might start with holding youth accountable or identifying needs, because that's early on in the system. And ultimately, the last one on the list would be keeping youth from entering the system. Or maybe it's even diverting cases out of the juvenile justice system or keeping them out is first. But what are some of the inputs that you need to do these things? And don't overthink it. It's real simple.
Program staff.
Yeah, Staff, we need
And-
you guys.
Right, and funding.
So we're not going to do these exactly linear. We'll try it when we get to a truancy, but for this one, we're just going to list them out. So program staff, funding, probably
youth and
office. I'm sorry,
Oh.
go ahead.
Sorry, I don't know if I'm typing or speaking, so I just said I'll try to speak. Sorry if I cut you off.
No, no,
Parents,
go-
parents and guardians and the youth. So we need the participants.
Right.
Absolutely. Right, you can have the world's best diversion program, and if the kids don't enroll, you got nothing. You can't achieve a single one of those goals. Excellent.
What are some of the community inputs that you might need or other system inputs you might need?
You need buy-in from the county attorney's office for sure.
Mm-hmm.
And commissioners.
Possibly from law enforcement.
I know we need partnerships with other organizations,
Yep. Because you can't do it all.
a
Absolutely.
lot of outreach.
That's really good, Michelle. And so if you were doing this on your own, you'd be probably more specific about who those partners are for your own individual logic model. Do you need
Oh,
curriculum?
Yeah, I was
or-
gonna say specific programming that you would offer.
Mhm. If you don't mind, let's go ahead and go to the next column. So Terry, what was it that you said? Because I thought when you said it, I was like, that's an activity.
The decision-making skill or program.
Teaching,
So that's probably a specific type of program, right?
That would probably involve all your programs, even your substance program, your social boundaries program. I mean, those type of things.
Mhm.
I would just list them as classes. That's what I list them as on mine, is just classes provided.
Specific classes.
yeah. And then maybe make it the action, right? Like teaching the classes.
So things to think about, and again, if I was putting these in order, I mean, logic models can take you hours to do, but one of the first steps to even getting to those activities is that you need the county attorney to refer that case. So an activity is you need referrals. And we work with communities that don't see enough willingness to do that referral step, or there's certain kind of cases they don't refer.
Right. And once you have that referral, what happens next?
I was just gonna say, I think there needs to be an intake process of some
Mhm.
sort. And then regular meetings with the youth and or parents.
Great.
This is where assessments come in.
Mhm.
And what could happen with those assessments? So you get referrals to your program, but I think, do some of you make referrals to other programs or classes?
Yeah. So the one up above, referrals in, and one could be referrals out.
Great.
Sorry, I'm going to keep nudging this forward. I know this isn't perfect, but this is really to give you the broad overview. So participants, we've started talking about this. You cannot do this process without the entity referring, so your county attorney or your school. So referral agency is who I would list as a participant for referral partnerships and like that. And the youth, right?
Parents and
Frequently-
youth.
Mhm.
Mhm.
Outside resources,
So be more specific, Terry. What would that be?
like Like we have counselors, we have therapists, we have our class and directors like for anger management, all those type of things that we resource out to.
Great. And the reason that's so important to be specific is, remember when we talked about earlier, like this helps you identify those resource costs, right? So if you're having to budget or you're needing to identify where to get different resources, that's why it's important to be specific.
Can you
And
add,
then, go ahead, Joe.
sorry, can you add parents with youth and maybe also add administrators?
Maybe put parents up with youth, do youth/parents, because we probably, oh, you've got it, I'm sorry, but we probably all worked with youth. The youth seems willing, but the parent won't drive them, so. What is going on with Zoom today? It's like wants to convert. Okay, so let's talk about short-term goals, just because we will move on to an attendance model here in a minute. So what's the short-term goal of a diversion program?
My short goal is always to stop the behavior for, to kind of interrupt that line of thinking or doing.
Mm-hmm.
How about facilitate engagement of the youth in the process, engagement in the process?
Absolutely. Get buy-in, right? We want the parent and the youth to see the value of it. So what's a medium-term outcome? Intermediate is another word we use for this.
This might be your successful completions.
That's exactly what I put. Graduate successfully from your program. Because I'm just going to point this out from a cost benefit analysis. If you enroll, you do all the steps up through that short term and you've done it beautifully. And then the youth does not successfully complete. They go back to the county attorney's office. From a systems example, you've just used all of your agency resources and all of the court's resources if that youth then goes back to court. Now, obviously, sometimes it's unavoidable and you didn't get the buy-in, or, the youth has another law violation. So sometimes it's unavoidable. But we have to think about that this as a very concrete goal, because it ties very exactly keeping the youth out of the system, not just long-term, but in that immediate example. And there's a cost when we don't do that, like a financial cost. We literally pay twice for that youth because your agency uses resources, and then the county attorney or whoever the referral agency uses resources then to address that.
Can this also be like the resources have been put in place where it's something they continue on even after our completion, they still continue with that, at least resources have been, the underlying issue's been defined and resources put in place. I don't know where that goes.
Yeah, I think that's a good intermediate goal, right? Like maybe they now have contact with an ongoing therapist, right? Or continuing resource. Yeah, I think that's perfect.
Yeah, or like
And
a
then
mentor or something.
Long term, really, the goal is that all of these things they picked up along the way, this getting out of or diverting out of the county attorney's office or the official process, the ultimate goal isn't to keep them out of that office. Well, it is, right? Is to prevent all of those subsequent law violations. And that they've learned the why of that. Why is it important to?
So yeah, your long-term would be no further law violations or system contact.
Engagement and more pro-social positive activities.
Yeah, right.
I think also reported like through the parents, follow-ups, improved behaviors at home and at school, reduction of crime in the community, you start noticing. Or I guess, I don't know if that's a big, long-term goal there.
Yep.
Yeah, but really, it's on our radar, right?
Mm-hmm.
If you could wave a magic wand and work perfectly with every youth, you definitely would see the overall community levels of crime go down. So
Mm-hmm.
I'm sorry, you can see how this example, we will move to an attendance model next. Amy, if you can save this one. And I get that we're moving super quickly. Stick with us, and I promise I'll let you, we'll get a breath in a minute, but we'll do a truancy one and then we'll stop and see if we want to combine.
Let me send you a link, Amy, for a blank one.
Yeah, we'll save these and we'll maybe work on cleaning them up a little bit, and we can post them on the EB Nebraska website as some examples for people, if that's helpful.
Okay, just because I promised people when they came back that we'd be, if they stepped away, I couldn't tell from my screen, but one of the reasons I wanted to make sure we go through at least diversion and truancy is sometimes we combine those program types under one agency or one umbrella, right? But hopefully we'll see there's some key differences. So what are some of the program goals of an attendance program?
Improve attendance.
Yeah. So I talked to a lot of programs, and they this is something that's super difficult to measure, right? You all know by entering it in the system, and it can be a super big headache to do those subsequent tabs. But unless we measure those variables, we cannot document that we make a change. So
To build youth and family relationships with the schools so the youth will successfully attend the school.
Yeah, absolutely.
With school professionals.
Mm-hmm.
Might it also be to identify barriers to attendance?
Yeah. Thank you for typing, Amy. I can't speak and type at the same time. So what about, like, do we want youth or families to see the value of education, right? Maybe see the long-term vision that education can achieve.
Improved grades.
Mm-hmm. Academic success, maybe, is how you could frame it. Sorry.
My hope is always to lower the amount of times they go to ISS and OSS.
So lower in-school discipline or in-school. That's interesting that you bring that up, because that's really kind of it's interference with that school family engagement, right? When a school says, whatever you've done is so harmful, you can't be here, or so disruptive, and trust me, personally, I know the story. Right? Is that its own goal? I mean, we can leave it as its own goal, but when you're thinking through these on your own, does that go towards that family engagement? Like, how do we repair that relationship? So what are some of the things we need for inputs? And we can go on with lots of goals, but in the interest of time, I'm going to move us towards inputs. What are some of the things we need to do to improve attendance? What are some of the steps we take now?
Collaborate with school staff.
So you need staff and school staff.
Communication and collaboration.
Yep, absolutely. Do you need the youth cooperation also? So I put the youth in there. You don't have to list all the words, but youth.
The family unit.
Mm-hmm.
I think the parents are really important, because if the parents don't understand the value of the education, the child's not going to.
Yeah.
So I think their understanding of that importance.
And I hear a lot too that reliable transportation is a big reason for families being truant. Or kids being truant. So reliable transportation. I know that goes with parents, but
Sometimes
I
it's
guess-
beyond like the parent
Yep.
may have the, right?
I was gonna say, I guess high school kids can drive themselves to school too. So reliable transportation.
But also communities, like if we didn't live in the ecosystem that we do, if we all lived in New York City, that would be a totally different issue, right? Like if the youth was willing, the parents willing, they could hop on the I train or whatever, right?
Mhm.
So reliable transportation and systems. So I have a question for each of you, and maybe you can raise your hand. Do you prefer to continue going across this one and work through this one and maybe one other goal, or would you prefer to work down and we probably won't have a time to get across all of them? So raise your hand if you want to just keep going with this one and go all the way through outcomes and then perhaps get to one other one with the little reactions, if you can raise your hand. So keep going. So anybody? Okay, how many of you would prefer to go down and work through some of the other program goals? I'm not seeing any hands, or one, no. Okay, so I'm hearing or seeing we keep going program goal and working across. Everybody else see that too? Okay. Okay, so what are some of the activities to improve attendance? Maybe let's think about them, try to think about them chronologically. So a lot of programs, they start by this collaboration with the school, these inputs. What they do is they generate a letter, right? The warning letter, I think a lot of schools call it. So one activity is a letter.
So I actually try to work really closely with my school, and I'm probably in a different benefit because I work in the school. So I'm very much a part of everything that goes on there. So as soon as they send those letters out, the office managers and the buildings actually send me a copy of those letters. And then I send out emails with those attendance assessments to see what's standing in the way, which I never get back from parents ever, maybe twice. But then I also sit down and have every student fill one of those out. Because even if I can't get the parents to do it, I at least know what they feel like the problem is. So I have the benefit of being able to work with the school and what their policy is already, but I had to go ask for that, even being in the school. I had to go ask, what is your policy in place right now? How can I like weasel my way into that and use that to the benefit of the program as well?
Absolutely. That is
So I would
such
say
a great
check with their policies, like talk to the admin and check what their policy already is. And see if they can add you, implement you in there somewhere so that it saves you an extra step.
Yeah.
I think this is rather obvious, but monitor attendance ongoing.
But that's definitely an activity, right?
Mm-hmm. Right. And it takes time.
Absolutely.
I was just gonna say, and resources, right? That's a resource point
Right.
and a data point.
Right.
We actually had a study hall, mandatory study hall where kids can go on, then they are sent to instructors and so forth to get work done, to figure out what needs to be done to improve.
We would sometimes call the home in the morning and make sure that they were up. Give them tools to get up in the morning. Their cell phones are often the best, but also easy to shut off. So we would call them on their cell phone in the morning and give them a hello, good morning. And sometimes they may have already missed the bus. So we would go and pick them up and transport them to school, kind of go out in the best mood, try to get that positive day started, even though we've already maybe missed a class that morning, or maybe we're getting them there right in time. I think one of our biggest assets for our program with the activities was when we could have a staff member in the morning go out and collaborate with youth and be like, hey, let's do this, and or process in the car to get them into the school if it's the anxiety piece, walk them in or not walk them in if we're embarrassing, just kind of knowing your youth and what each individual youth school issue is, and then working around each youth. It's a lot of work, especially when you have 40, 50 kids on a program and 20 of them are home in the morning trying to spend that time, but just picking a youth for the day to focus on and hoping that you can get them into the school. I think getting in the door is the biggest activity that there is. Once you get them in the door, then at least that's start one.
Yeah. And I think you're exactly right, Michelle. Like, encouraging that positivity is so exhausting. When you were talking, I was probably making a face because like, oh, that sounds pessimistic of me, but encouraging positivity is so much work. It's really tough. So
I
let's
had
go ahead and
one
move.
girl, I told her I would bring pom-poms and yell, "Go Trinity," as she walked into school. That's what it took.
It's
We
so
had a
good to
kid
hear.
that we would try using incentives because we had a kid that really liked Hershey chocolate bars. And so I was like, I will give you a Hershey chocolate bar every morning if you make it to school. And then you're like, well, what do you do at that point? But, we did it and it worked for a little bit. And then, I said, I can't do this for the rest of your life. And we didn't. I mean, he started going on his own. So there was the incentive piece to that. That we utilize, and that was always fun.
Mhm.
I think that's a great point, Michelle, and because those incentives you would want to put under inputs, right? Because those are tangible things that you need to, but disseminating incentives goes under your activities, right? So that decision-making process of who gets an incentive when would go under your activities.
Okay.
Another important thing is building a schedule that is maybe successful to them with who they are or how they, their IEP. I think that a lot of kids that I worked with at sometimes that first hour class, it's got to be something that they like. It's not always, I had a lot of problems in the years with kids that had like PE first hour. So that's kind of that activity of building a schedule with them that makes them feel like, okay, I can be there. Or
that's a really good, I think we do need to move on to the next column, but I think that's a step that I don't know a lot of programs consider, Michelle, like that, because every youth is unique. I was thinking about my 15-year-old. PE first is great because he literally sleeps in his gym clothes and rolls out the door. That's probably TMI, right? Like, but for other kids, they're like, oh no, not PE in the morning. So that individualization is a really important part of those activities. And that kind of goes towards like the assessment, right? Whether you're doing it through an interview or a formal tool, knowing what that youth's barrier is huge in changing the long-term or medium-term outcome. So participants, we have some of these already listed under inputs, but you can see you need staff to generate a warning letter or to produce or walk a youth through an assessment or an interview, right? And family. One big barrier we see, or one place where we see things kind of not flow as well as they should. I can't remember who said it, but when staff are not within the schools, when they don't have the internal ability, we see a real disconnect and a huge, I'm sure many of you, when you go to enter your data, when you don't have that embeddedness in the school, or you don't have access to, I think it's still called Power School, it creates a huge headache. So I think participants, I would say administration is a huge participant that needs to be at the table, and attendance staff, unless they give you access.
I have to have parental permission to have access to each kid's Power School. Is that the same for everybody?
No, it isn't for Saunders. We do a interlocal agreement with the school. So their attorneys and our attorneys work out an agreement. So we're essentially like school personnel.
Oh.
I think for us, it just depends on the school district, with working with OPS and Bellevue and Papillion and Gretna and Millard. Every school district here has had a different view on that, so.
So that would really be more an activity, right? Is getting that permission piece and developing a process for getting permission.
Yeah. So hopefully you're starting to see like that not getting permission where you can't get access to attendance. That's definitely looks like a process evaluation question, right? Versus if you get the attendance and we are not able to calculate the difference, that's an outcome issue. So these really do intertwine with each other. And that's why it's important to kind of go through each step. Let's talk a little bit about short-term goals then. I recognize like when you get these tools in your own hands, you'll want to mess with them and add things and separate them and you put them in order and you'll want to make them your own. But what's the short-term goal of an attendance program?
Get kids, Vanessa said, get kids to school. Yep.
And I would even break that down more and say, not just getting them to school, because to me, like, obviously that's the goal, right? I would say like, if they're missing 4 out of 5 days, get them to school 3 out of 5 days. Or, you know what I mean? Like, if I said that wrong, if they're only there 3 days, get them there that 1 extra day, just like baby steps with them. Cause like, for the most part here, our teachers are really good about, we're just glad you're here. I don't care if you're 10 minutes late, you're here. So that's good. But yeah, tiny baby.
And even before these, I would put maybe at the very top, I identify the barrier, which I think in practice you all do, right? When we go to put it in words, sometimes we're like, what is it that I do? Because you're doing it intuitively. But when a youth comes in and says, my parents' car doesn't start every morning, we all have identified what the barrier is. So you probably immediately go into solutions, right? So I think identifying the barrier so you can start working on them is a great, like, short-term, probably like first 3 days in the program thing you got to do.
Vanessa said, improved grades.
So I would actually put that towards a medium-term goal because grades take time. Again, speaking from my own kids' experience, like they want to turn it on a dime, right? They want the Titanic to move overnight, and you can't go from missing school to improve grades in a short term. It needs to be at least a couple of weeks. Sometimes, I mean, I guess you could do it in a week or two if you have a big test or something, but I would put it as a medium term or an intermediate goal.
Kind of to that permission to check and those kinds of things. Like sometimes your short-term outcomes aren't all youth related. Sometimes their could be system related. So you've achieved a process for accessing permission or something like that. I don't know, Ian, is that off base or?
No, that's it's kind of making sure your process works.
Mm-hmm.
I was thinking along the same lines, but I was thinking more when you identify the barriers, sometimes it entwines with the process. That must be my word of the day, right? But I'm thinking we had a couple of cases where right off the bat, the barrier we identified was medical. So it helped us kind of work with the family to get a solution, but it also made us go back to administration and work through the policy. So some things, you know, they're circular. They're not exactly aligned directly across to the next step. Because we had to ask, the youth had diabetes and wasn't balancing her blood sugars. And I was like, really, is this what the attendance policies are for? So we had to kind of This is an old example on a truancy evaluation I worked on years ago, so it's probably changed, but early on when our attendance laws passed, the type of attendance didn't seem to matter. And the type of absence, I should say, versus now I think we've gotten better about, I mean, a short-term goal, if you're identifying the barrier, maybe identifying the absence type would be really important, because if it's illness related, that's really different than somebody who's genuinely truant, or if it's, hopefully that's making sense, but.
So what I hear you saying too is that there could be some policy changes within school that are
Yes.
related to truancy.
Yeah.
And how it's handled.
Yeah. So I think we can move on to some of the intermediate term goals. These really are, we want the youth to, and Amy, I would probably put these above improved grades, right? We want to match, we want to meet whatever that, we want to match or overcome that barrier. I'm struggling with words. After we've identified the barrier, right, we want to, if we can, hopefully get the youth and family to overcome that barrier. So I've worked with some programs that they literally put a hygiene closet in their school because they were working with populations that hygiene was why the kid didn't want to come to school. They didn't have a washer. Parents hadn't washed the clothes. So getting those resources in place, I think is an important, that might actually even be short-term, Amy, now that I'm saying it out loud. Because the medium is we want to overcome that barrier, right? We match it and then we want to overcome it and have them successfully complete your programs. Like that's really what we want to see happen. What are some of the things that, like, as youth are completing your attendance or your truancy programs, what are some of the things that you're like, oh, this, I can see this youth or family are on the right path because X is happening? What is that thing that's happening?
I always try to encourage the kids to show the teachers they have a different outlook, so we can take the teacher's attitude toward some of my kids, if that makes sense.
Yeah, attitude change, big one, big.
Vanessa also added engagement, which I think is super important, being able to know that youth is engaging better at school while they're there. Again, hoping to hit that long-term goal of getting them to stay in school and attend school more often. And that kind of also pulls into some of those issues with that barrier and identifying it and making sure that we're overcoming that.
Yeah. Okay, keep thinking about it, but let's now nail down the long-term goal. Ideally, what do we want an attendance program to do?
Graduate all the kids.
So I actually had put that as intermediate, but do you mean graduate from your program or graduate from high school?
From school.
Yeah. So that's a great long-term goal, right? Is we want kids to have enough credits to graduate from high school. So a lot of times that's after our programs have worked with them, right? So that means their attendance has to continue to be adequate or great after your program has worked with them. So when you're thinking about JCMS, when you see that post enrollment, not too many attendance programs capture this, but it's when the youth has completed your program, if the school or administration allows you to gather that, even if you only do it once a year, if you go out and gather that post attendance, and if you want to, but you don't have the resources, I encourage you to reach out to JJI, because this is something that we really want to know, like after somebody works with a program, what's the long-term success of that intervention? So sometimes you'll probably recognize, I often use like a medical model, and you can tell the quality sometimes of an intervention by that duration. Obviously, some things are not designed to work like into adulthood, But if you think about it from a medical model, like if I have high blood pressure and I take a medication, that might change my blood pressure for the short term. However, if I change my diet and exercise, that may really get at that long-term goals. So sometimes we want to do both interventions because we're having me maintain an acceptable or healthy blood pressure while I get to those longer term goals, because diet's not going to change the Titanic overnight, right? It's not going to shift all of my numbers overnight. So Amy, I thought you put down graduate school and I was like, what? No, I got it. Graduate from, we have a small typo there. But graduate school maybe is a long-term goal. Anonymous chipmunk. So really, when we start thinking about long-term goals, really, we want kids to graduate. Like when you see some of the research on attendance programs, those are wrapped up in higher socioeconomic status, right? Better physical health. So when we look at long-term goals, attendance and pro-social behaviors linked to some long-term health goals as well.
I always want them to become successful adults.
Absolutely. Yeah. One of the first nonprofits I worked for, I'm trying to remember, their mission statement stuck with me so well. It was something like cultivate youth so they become productive and healthy adults or something. And I always thought, oh, what a great mission. Like, right, you're looking towards that long-term goal. So we'll save this one and then we're going to try to do one more and then allow for a short break before we take one and go in depth in one. So as Amy's kind of saving this and working on the next one, do you guys want to take a 10-minute break or do you want to dive right into we can either do prevention or promotion, or what was the other one that was in the chat box?
Mental health.
Yeah. So we will have to select between those two, but we could use one of them as a deep dive when we get into the 11 o'clock hour. So raise your hand if you'd like to take a break now, or if you want to just keep right on going. Raise your hand for the break.
I'm seeing some hands raised for taking a quick break.
Okay. Let's do a 10-minute break. Actually, let's make it 13 minutes and we'll go to 11 o'clock. I realize that's getting us into our more in-depth time, but I think that's fine. We can pick it up. Let's take a break until 11 and then we will come back. Try to come back right at 11, just so I think you can see we have a lot of material that we can go through. We could talk about this all day long, but we don't have it all budgeted for that. So, all right, I'll see you all back right at 11 a.m. Thanks. And so if you would really like to either pull yours up or have us work through yours or update one of yours, will you please raise your hand now?
Or even you guys can feel free to reach out to me and I'd be more than happy to schedule a meeting with you to go over it.
Amy, I'm sorry, the microphone is not working well. What did you just say?
Can you guys hear me now?
Yeah.
Said you guys can also email me and we can schedule a time to meet to go over logic models if you don't have time right now.
Amy, go ahead and put your email right in the chat box if you don't mind, please. That way everybody has it. They can start blowing up your inbox right now.
And if you've already reached out in the chat about wanting us to follow up with you about logic models, I have your names written down and we'll make sure to follow up. I think I have both Michelle's right now. So Michelle Siders and Michelle Butler. So we've got your names down, but if you are anyone other than that wants us to follow up, Amy dumped her email in the chat there. I also put another link to a blank Google Doc for the logic model in the chat.
So I don't see anybody's hands up for going through a specific like programs model. So what I'd recommend, unless if anybody has any discussion, jump in, because this is meant to be interactive. But I think it might benefit us to do a prevention and promotion model and then try to go as in-depth as possible and then put them in order. And we should wrap up, even if we go in depth, we should wrap up by about 11:30, have some time for questions, and then still get you guys off for lunch by about 11:45. So the reason I'd recommend doing prevention and promotion, and Julie and Amy jump in, is wow, we have such a variety of prevention promotion programs, and some of them, the term's misleading, right? We have some programs that are really working with high-risk kids if they're doing some kind of gang intervention. So we have lots of very specific types of classes and things that should link back to specific goals. So I think that this would allow us to, without doing a specific model, I think this would allow us to have you guys throw out maybe a specific program goal that's in your mind. I'll use gang intervention again. That's the one that came to mind. And then we can talk about like work across them. And then that might be of some benefit to each of you as you work on your own independently or with us. It's kind of a starting spot or a starting place. So does that sound okay to everybody? Does that work? Okay. Thanks, Connie. In the world of Zoom and screens. Okay, so let's start with, like I said, the word prevention promotion can be a little bit misleading, but I'd like you to think about a goal of a program that you're trying to achieve. And so many of you have an agency that runs like 5 different things, multiple things going on. So can somebody give me an example of something they're trying to achieve in their program, and we'll just work it all the way across. You can say it, speak it, or put it in the chat box. Jill, I see you unmuted. Did you mean to, or am I just
No,
picking on you?
I do not. Thank you.
Okay. Did Michelle Siders drop off? Because I know she had some programs she wanted to talk about. We lost some people when they went to break, didn't we? Okay, so why don't we? Oh, good. Thanks, Kristen. Why don't we use this one, increase strengths and resiliency? This is a great one because it's across multiple programs, right? You could be doing this in a lot of different programs. So does anybody, I mean, I know some of you do this now. So anybody who currently works with youth and tries to increase strengths and resiliency, what are you doing? What are your inputs? You have a specific program model that you use? Because I can think of.
I was going to throw out 40 assets, 40 developmental assets, and staff.
40 developmental assets.
Youth
staff.
And parents.
Always.
For us, it's also community partners. So schools sometimes host trainings, other community partners host trainings.
And I'm glad you mentioned partners, because even once you identify an asset, if you really want to grow that asset, then you have to, you know, place or find a place for the youth to go to grow it.
Natalie said,
Trusted-
echo 40 developmental assets, building trusted adult relationships through one-on-one connections and having consistent, caring, helpful adults.
So this is the perfect example, the 40 developmental assets. I think she was just echoing it, Amy. You just
Sorry.
could have put ×2. So the reason
I would also add that 40 developmental assets has a lot of great materials and or assessments or surveys that you can use.
yes.
You know, their materials, they've got a lot of great supporting materials and training.
Yeah. And training. Yep, absolutely.
One of the things I see on our old project model was the funding sources and sponsors. So just making sure that all of those are.
Yep,
in
funding
place.
is huge.
Mhm.
I would probably put training over under activities, and correct me if I'm off base there. But I think about with those different assessment tools and stuff, one of the activities toward meeting that goal is training your staff on how to give those assessments, and actually, and also, you know, using the assessment tool with the youth, families, what have you.
Yeah.
And on the curriculum as well, because like me, I have a new staff member, so she's currently going through training on the actual curriculum that we're using.
Mhm.
Vanessa also added in the chat, youth for thrive, protective and promotive factors, and coach sessions.
So Vanessa, I have a question. Thrive is a different model than Search Institute's developmental assets. Is that correct, or is it same?
Correct. Youth Thrive is different, but it's centered around those 5 protective and promotive factors. And so our coaches, that's really their purpose, is to strengthen those protective and promotive factors. And then each month we review, you know, what have they done to do that?
So Amy, I would put this under, you can put it under a different input. So put it in the box below. And this is when I talk about going more in depth. The reason is, as you get into specifically different models, you have different activities, and Vanessa started talking about some of those. So you can see your program goal of increasing strengths and resiliency, your inputs can be different and your activities and everything flow differently. So Vanessa mentioned, and Vanessa, correct me if I'm wrong, but you mentioned under Youth Thrive, some of the activities, there's 5 different domains, or how did you say that? 5 different activities? So with each model, you have different activities, right? And it's important to point those out because you don't want to lump them together. You won't maintain the integrity of it if you don't keep them separate. So when I heard a different model, my brain immediately switched to a different line. Okay, let's go. Also under the program goal, or the increasing strengths and resiliency under the 40 developmental assets model, I know that there are, you can go kind of the next level and you can look at youth sparks. I think that would probably be an activity, is identifying youth sparks. I think they're still called that. It's been a while since I've used it, so.
Yeah, that's right.
And what are youth sparks?
It's when you use developmental assets, there are it's really what motivates the youth is their intrinsic things that interest them and move them to the next level or keep them out of trouble with the law. So if you think about it this way, parents sometimes explore sparks and dive into them kind of naturally or organically. So you might enroll your kid in 5 different sports over their lifetime to see what they're good at. So finding a youth spark is really about identifying the thing that they excel at or in tune with, and that motivates them, right? Like if nobody else is around, if your kid's playing soccer, it's probably one of his sparks. So it's kind of the things they do on their own initiative. And the Search Institute's done, I've read books on it, so it's been a little while, but they have a whole research division just on identifying sparks and building those in youth. But they build off of the developmental assets.
So if anybody has information that they can give to get us there, please let me know. I do have something with the 40 developmental assets. And
go ahead.
We do try to have them, we use creativity and purpose to try to help them. I think we're on the right path. That's why I wanted to go a little deeper, but I think we're on the right path since you explained it.
Yeah.
Identify youth sparks. Okay, thank you.
And I'll try to find some more resources. I know JJ, I had a series of books on it a while ago, and I have some resources I use with one of my classes. So I will do that as a follow-up. Is that Michelle that was asking for that? Sorry, I wasn't looking at.
I think
Yes,
you can
Michelle
go to
Butler.
I think you can go to the Search Institute website too, and there's some specific materials that you can purchase related to the sparks.
Excellent.
Search Institute. Thank
Yeah,
you.
Search Institute, you bet.
So let's keep moving through this 40 developmental assets because the thing with assets is you can really do a deep dive with these because those of you who have worked with them, there's 40 of them, right? And so the things that flow from them really will shape who the participants are. Not so much the youth, right? Like the youth is the youth, but once you identify one of those assets, then the other participants really could go into the community or lots of different directions. So one of you that's currently using the 40 developmental assets, or I can mention one, but tell me somebody that would be a participant if you're trying to plug your kids into one of their assets.
A lot of our
Oh.
focus goes to
Oh.
training, offering parenting training. So offering get-togethers for parents to learn about the assets and how they can just become more familiar with them and maybe more intentional in their interactions with kids, but also school personnel too, teachers.
Yeah, excellent.
And any of us working in prevention, really.
Yeah. And I
For
know.
us, go ahead.
I was gonna say, I know we
gonna-
use
I don't
prevention,
know.
but everywhere.
Sorry, I think my computer is dragging in. I'm sorry. I'm not trying to cut you off.
Go ahead.
I was just gonna say for us, we partner with community resources. So I go to a lot of resource fairs and I'll talk to people. And then we have a family resource navigator that we implemented with our programming. So she has interviews with the families, and then we'll try to do it both ways. And then in a group, we try to work with the youth. So then we'll have partner organizations, we'll have them invite them to our group to speak to the families and offer resources. So just exposing them and getting them connected with different resources really helps to identify other things that they probably wouldn't have known about before. So it's one of our ways of doing things.
So can somebody throw out a list or throw out a couple of different assets?
Increasing the number of caring adults in a child's life. I guess that's the one we focus on most, is really connecting and helping kids identify other caring adults in their life who can support them.
So one of the things I love about using this example is almost all of those assets are also activities, right? So if you know your population needs that, almost all youth need that increasing a healthy adult in their life. That's, you can really dig into each of those, right? But then you do need those community partnerships, either through a mentoring program or a volunteer through your church. So you can see how each of these can just be exponential. You can end up with 20 items listed under just increasing the number of healthy adults. What's another developmental asset? I should probably just Google them.
I have a list right in front of me. It's on my desk. Family support, or a caring school climate, youth as resources, service to others.
Yeah. So youth as resources is another really excellent one that you just need those community partners, right? It's one thing for our agencies to value youth, but when a youth feels valued by the Humane Society or their local school, you can see how that can build capacity or build strength and resiliency. I think so far we've been talking about a lot of external assets. How about internal assets? And Amy, I would move down below the block that we're in right now. Sorry, I lied. Can you go back up?
School engagement is one, bonding to school, reading for pleasure, integrity, honesty, responsibility, planning and decision-making, resistance skills, peaceful conflict resolution, personal power, self-esteem, sense of purpose.
So let's take a couple of these because you'll see the participants are quite different. So let's use reading for pleasure. Who are some of the participants that are going to be related to reading for pleasure? Always the youth, so I don't think we have to repeat it, but
right.
Natalie dropped in the chat, and I think it's kind of related to this reading for pleasure. Youth spending time in other organizations, whether that's a club or any kind of community organizations, which may help them build that reading for pleasure skill. Also, parents being actively involved in that, whether that's through helping them acquire reading material that's something that they're interested in. Right. And maybe the, program personnel also helps with that. Perhaps the youth doesn't have money to pay for a book and they don't have access to a public library, like Kristen just dropped in the chat.
So the short-term goal, so let's just work across a couple of these, and then I want to talk about assumptions and obstacles. So short-term goal is you're going to see the youth pick up a book, right? You're going to see increased engagement with literacy or books. Long-term goal is probably literacy, right? A long-term engagement with the written word.
Michelle dropped in the chat, increasing SEL skills, that's social emotional learning.
I would think their vocabulary would increase also.
And go back to SEL. Thanks. Thank you.
Yeah, and maybe you see, you know, that vocabulary increase, that reading comprehension and reading fluency scores increase on those, you know, next quarter or, you know, year-long assessment that the schools give, which again, programs may not have, you know, have the ability to check that, but still there. Kristen also adds in grades increasing.
Absolutely. And long-term, I think it would link to graduation, right? Rates.
Right.
Absolutely. So some of the assumptions, so when you get into logic models that that kind of go more in depth, you frequently, and I think we'll send you an example or we can pull it up, but there are models that have boxes that show the assumptions we're making when we're working through these. Thanks. It looks like one of you is going to share the screen. So I'd like to show the screen at least so you can be thinking about it, because frequently when we're laying out one of our programs, we're making an assumption, whether that's access to a library, right? Like I live in a town of 100, there's no library. There's not one close, and there's no transportation to go to one. So we need to do different types of activities to get the books to me. So you have to, when you go in depth on some of these models, you really should think through obstacles and barriers. Those can be community, those can be a pandemic, those can be transportation. But they really do, if you think through the assumptions that we make, or we might be making the assumption, for example, let's say we work with a funder who provides boxes of books. In the foster care system, we frequently got books. And I always wondered, because they always came to be in English, I always wondered, what if I don't have an English speaking child? So this other model that you can see comes from another research from the University of Arkansas. It's helpful when you start thinking about the assumptions and the external factors as you, sorry, I hope you can't hear my dog, he's going nuts. It helps us to really think through, like, how do we make this super achievable? Because we have to be prepared for obstacles. They happen all the time, and sometimes totally out of the blue. Like I mentioned earlier, COVID completely changed how we implemented many of our programs, at least for roughly a year or so. So keep these in mind, and we can go back to the other screen, because I'd like to work through at least one other, maybe the responsible decision making, or one of the other developmental assets was something like repairing harm. So thanks, Amy, for doing the Zoom jujitsu. So I think we can keep using 40 developmental assets, but let's look down to the one that was planning and decision making, or if somebody else has a model they would like to dive into. Is there one that would be best for the youth that you work with? Amy, can you scroll down on the page? Thanks. Okay, you can go back up. Are you guys all good with staying with the 40 developmental assets kind of thinking, or is there a different type of program that you want to walk through? Okay. Then we'll go with this one because I think a lot of diversion programs, especially in our rural areas, we use responsible decision making, or this kind of goal with our youth. Really the end goal is we want them to make better decisions, right? And not do those impulsive actions or break the law. So sometimes when I'm doing a program or a logic model, sometimes I'll start with the very end, and I'll be like, what is it that I want to achieve? So you can see Amy starting to do this, right? Like, okay, I really want short term, I want kids to make better decisions because the long-term goal is I don't want them to have any kind of contact with the law. So avoid system involvement. We can make it really broad. You could say juvenile or adult, right? Any kind of criminal justice system involvement. Thanks, that's fine, you can. So sometimes when you're like, if you have a grant in front of you or you have a program model, for me, at least, it helps for me to start with, what's my long-term goal? And then I think about how am I going to go about this? So is anybody that's on the call, anybody currently running a responsible decision-making class or a planning and decision-making class, anything like that, or trying to achieve that in the youth they work with?
We are, we currently, that's a part of our program, decision making, conflict resolution, and things like that. But I'm trying to figure out. Let me look at our current logic model to see.
Yeah, and it's not to put anybody on the spot. I was thinking we could go to the whiteboard because really all of our diversion programs are doing this in some way. It's just, do we call it that? I mean, to be honest, all parents are doing this, right? Like we're all trying to teach our youth to stop, slow down, and make a better decision. Because that's, adolescent, the brain doesn't work that way. It's operating from a different cortex, right? The prefrontal cortex. So we're all doing this. It's really about, are we doing it intentionally? And then are we doing it using a formal model? So where I was going with that is, because we're all doing it, I'll tell you in a very informal way, the input is me telling my child to slow down and think about it. The more formal approach is you have either a responsible decision-making curriculum or something very formal. So your input depends on what approach you're taking, right?
So I have, so for us, we help them to understand the impacts of their involvement with the justice system. So we help them to really first see that, because if they continue with the behaviors, then they will have some negative impacts with the justice system. Our program can prevent them from going before a judge and possibly being convicted or doing whatever. So we first start off at orientation, helping them to understand that. And then we help them to understand their role in their actions, because we don't really get, the Juvenile Assessment Center won't tell us their charges. So we just talk about just the basic behaviors, their role in it, taking accountability and responsibility for their actions. The parents might come in and say their kids didn't do it. They'll come in and take full responsibility based off of how we interact with them. But they do it, it's kind of the norm for everybody to be in a negative mindset now, I'm starting to see. So we're just trying to help them to change their mindsets behind it. Trying to see the importance of being in school and going to school, not fighting and skipping class and sneaking in the bathroom, doing drugs. We talk about the gamut of things that they're experiencing. Let me see. So yeah, understand impact, discuss behaviors about what you. Sorry, I'm just following what she's saying, making sure. But I think that's the track you're going on. I don't know. That's the track my mind was going on.
Yeah. I was just going to say, you said something and it triggered, it sounds like the referral source is not providing the underlying offense, which is probably a process evaluation problem, right? There's a problem with that process, because ideally when you're working with youth, you have as much information as possible so you can target the interventions. And I get that sometimes schools and stuff don't want to do that, but that can be one of the inputs, right? Is information from the referral source.
Well, for us, I can put a little context. For us, we have a leadership mentoring type program. So, and it's for African American youth only, ages 10 through 17. So we're just trying to build on the positivity. So we don't really talk about the offense or anything. So it's building the leadership skills in them and social emotional skills and things like that, just to get them a little bit more ahead of in their life, because it's just like building those what do I want to say, promotion, what is it, risk or promotion, so promotion factors in their lives, or promote, I forgot what it's called, there's risk and promotion, I think it is.
So let me
So-
ask you, so you're increasing their planning and decision-making through positive role models who look like them. Is that what you said?
Yes, we definitely do a supportive, caring, adult approach. So everybody is where, because I mean, one of the barriers are that they're not really able to engage with people in the normal settings. When someone looks like them, may have come from a similar life experience, and they can really see that we understand. A lot of the people that I work with are currently going through things with their own kids. So it's not like, I mean, they've already told me several times, Miss Michelle, your kid's probably never been in trouble. And I'm like, you're right, but I was a trouble kid. So although I'm decades older than them, at least there is a connection where they don't think that I'm just somebody who don't know what's going on. So it is a strength behind that.
The short-term outcome you're looking for, that you're talking about right now, is engagement, right? That they are engaging with you because of, or they're relating to you, or the adult mentor that you are putting them in contact with. Because if you miss that short-term outcome, you're not going to get your medium or long-term outcomes. So, and it sounds like, just from listening to you talk, that if you step it back, you're doing that by identifying. So one of your inputs is individuals who have similar life or a similar understanding of the environment around them, right? So you're not matching millionaires with people that are working with our kids, because then there's a total miss, right? We're not working with the same population. So matching the activity is really matching individuals, matching adults who have lived experience that is similar to your youth. And you need resources to do.
Like U-Turn, they use it, credible messengers. I don't have a fancy word for it, but for gang intervention, they use credible messengers, because they have to get somebody who kind of lived the life of gangs to really interact with those individuals. And that's one of the things our program is not. Like, I mean, although, you know, many of us kind of grew up, but we don't really have that gang intervention approach. So it's like, okay, well, we can only do so much. We need to get you possibly to a program that can assist you. So that'll be another referral that we'll try to make after they're referred to us.
Yeah. So I hope you guys are all saying, as we start kind of winding down, like, you have to take your specific model and really step it out and itemize every single input that you need, very intentionally having which activities link. So normally when we do this, you have each block is each step. When you do that, sometimes you'll be like, oh, for example, a lot of the programs I work with, they may really want to use that relatable adult, but they don't have credible messengers. They just don't have either individuals on their workforce, or they're in their employment, or even referral sources. So it should help you begin to identify places where maybe you could strengthen your model, or places where you're not achieving a short or medium outcome, or sometimes that outcome doesn't even link back to the program goal. So when you really get into these on your individual programs, sometimes you see a miss. Other times you see, oh, well, it's what we laid out in the beginning and it still seems to be working. So you really have to get one of these pages and start working on it. And like we said, I think JGI is happy to come alongside you, to take a look at it, review it, meet with you. So we just need to hear from you if you want that assistance. It definitely will strengthen your program model if you look at these in depth, because it'll show you places where things aren't connecting. And it's usually, a lot of times it's a resource issue. So are there any questions that people have? And thanks very much for the participation. I love the whiteboard activity. We'll definitely have to use that one again. It helps to hear from what's going on in the field. Julie, you probably see in the chat box that Natalie asked to be added to the list, so.
I've got it. If Sarah is still here, I've sent you a message, but I haven't seen a response yet. If you have your email address, if you could drop it in the chat, just so I make sure I've got the right person, that would be great.
Are there any questions? I know we've covered a ton of material, and by pedagogical standards, it's 2.5 hour training is kind of a no-no, even with a break. So it's a long time on Zoom. And that's why we tried to make it interactive and have you bring us information about your programs. Are there any questions that came to mind? Then what we'll do is I'll stay on for a little while, and you're welcome to start dropping off, but do, Tristan, I see yours. We will send the recording out to you later today, and then it will be eventually on linked off of the Evidence-Based Nebraska website. So feel free to listen to it regularly. And definitely we want to hear from you if you want to step through your particular model. I found that to be particularly helpful when we work with programs. So happy to help. Just tell us how we can help you.